The eC-Card gives young people in Essex access to up to 10 free condoms and 2 sachets of lube every 7 days. This service is accessible to those aged 16 to 24. Those aged 13 to 15 can also get access to the service, but are required to have a face-to-face assessment for authorisation. This video will complete your eC-Card venue training.
Some of the benefits of accessing the eC-Card include normalising condom use and enabling service consistency, helps to reduce STIs and unplanned pregnancies, increases the accessibility of sexual health services for young people, allows further conversations to promote healthy relationships and other aspects of sexual health. The app is easy to download and set up, ready to use. A quick summary of sex and the law. The law states that the age of consent for all sexual activity is 16, regardless of sexuality or gender identity. The law also states that anyone under the age of 13 cannot legally give consent. Sexual activity with anyone under 13 is rape and must be reported.
The law is not intended to prosecute mutually consenting sexual activity between two people of a similar age. This applies to those over the age of 13 and should always be considered within your professional assessment. Anyone under the age of 13 cannot sign up for the eC-Card, and if a young person under 13 was to disclose to you that they were sexually active, you would have a professional responsibility to share this information with Children's Social Care in order to keep the young person safe.
Under the Sexual Offences Act 2003, a person must have these 3 things to consent to sexual activity. Freedom. Someone consenting isn't put under pressure to perform sexual activity. Capacity. Someone consenting has the mental capacity to do so and isn't under the influence of drugs or alcohol. Choice. Someone consenting can say no if they want to at any time.
If you have any doubts on your assessment, you can always consult this flowchart that outlines action pathways. You were sent a copy of this if you complete our eC-Card Assessors training.
Health professionals use the Gillick Competencies and Fraser Guidelines to decide whether a young person under 16 can consent to their own medical treatment without parent or carer involvement. This includes access to contraception.
There are 2 different roles as an eC-Card distributor. These are being an eC-Card venue and being an eC-Card assessor. An eC-Card venue is the organisation that distributes condoms. All staff that work for the organisation will have watched this video or completed our training in order to familiarise themselves how the service works. The important distinction here is that a venue can only distribute condoms to those who already have the app and will not be able to assess somebody's suitability to download the app.
The role of an assessor is specific to the member of staff, not the organisation. In addition to working for an eC-Card venue, an assessor can also work with young people aged 13 to 15 and assess whether or not these young people should be able to sign up for the app. When an assessor meets a young person between these ages, they will need to have a one-to-one intervention with them and go through the safeguarding frameworks set up by the organisation. To become an assessor, you must have completed safeguarding training or an update within the last 12 months, must have an in-date safeguarding policy, and can access safeguarding support within their organisation if required. All documentation relating to the consultation must be stored in line with GDPR.
Once you've completed this video and filled in the eC-Card venue form, you will be sent the resources to act as an eC-Card venue. If you wish to become an assessor, you must take part in additional training as well as complete an assessor's form. It's down to the professional's judgment regarding whether they are Fraser competent. The professional must be satisfied that the young person will understand the professional's advice, the young person cannot be persuaded to inform their parents, the young person is likely to begin or continue having sexual intercourse with or without contraceptive treatment. Unless the young person receives contraceptive treatment, their physical or mental health or both are likely to suffer, and it is in the young person's best interest to receive contraceptive advice or treatment with or without parental consent.
This process would have to be done face-to-face with the young person. If the professional deems them suitable, the professional will enter the access code to the override system regarding the date of birth.
Interacting with young people around sexual health can lead to further questions on many different topics and conversations. This can range from queries on different STIs to managing healthy relationships and consent. If you wish to increase your knowledge on any of these subjects, Essex Sexual Health Service offers several other training sessions on some of these topics. Please check our Eventbrite for more information. You can find this by Googling Essex Sexual Health Service Eventbrite.
If you would like to direct young people to accessing this information, we also have a YouTube channel where we post informative videos that anyone can access. Some of these topics covered within these videos are what it's like to attend an in-clinic appointment and what is pleasure. We also have a condom demonstration video which can also be viewed on the Essex Sexual Health Service website and the eC-Card app. This is a useful tool that can be used in group settings or one-on-one when discussing safe sex with young people.
The process for a young person to download and sign up to the eC-Card takes roughly 15 minutes. Once they have downloaded the app, they'll need to register with their date of birth and postcode to make sure they're eligible for the service. They are then required to watch 3 videos and answer a few quiz questions. Once this is completed, they can then see a map of all the local venues.
For young people who are unable to download the app to their phone, they can also access the eC-Card via the website eccard.org.uk. Each venue will be provided with a display sheet containing a unique QR code that allows you to complete and record the issuing of condoms to users. The process can be broken down into 5 simple steps. The user informs the venue that they are a member of the eC-Card scheme. The venue then presents the user with their QR code. The user scans the QR code using the eC-Card app. The transaction will then be confirmed with an audible bleep and a message of completion on the app. The venue hands over 1 pack to the user.
As a registered venue, you will initially receive enough supplies that you'll be able to make up 20 dispensing units of condoms. You will also be given a QR code that is unique to your venue. 1 unit equals 10 lots of condoms, 2 sachets of lube, 1 paper bag, 1 instruction leaflet and 1 sticker.
Usage of stock will be monitored and a resupply triggered when you fall to or below 10 units. At this point, you will be sent another 20 units worth of supplies to ensure that you have enough stock at all times. If for some reason this has not happened, please contact the Navigation Hub. It's essential that when a service user collects condoms, that they scan the QR code provided with their eC-Card app and not their phone's camera app. If the service users don't scan with their eC-Card app, then we won't know that the condoms have been given out and can cause issues with tracking and resupply of stock.
Some organisations may be set up to support young people that may not have access or have restricted use of their smartphone. These select organisations will be given paper cards to distribute to the young person. However, that does mean the young person will only be able to access their condoms from the venue that provided the card. This is due to the organisation having to liaise with Essex Sexual Health Service to update them on stock to ensure they are sent new stock when required. If you think your organisation would benefit from this, please reach out to Essex Sexual Health Service to discuss.
To become an eC-Card venue, you can apply on the Essex Sexual Health Service website under the Professionals tab. If you wish to become an assessor, you can also get in touch with the outreach team and ask to receive an expression of interest form. Once the team has received this, we can look to either book you into our multi-agency training or look at possibly arranging for us to visit the service and deliver training. An eC-Card assessor must be satisfied that the young person is Fraser competent, as can be seen on the screen. You can also include during your assessment discussions around confidentiality, who is present during the assessment, what support the young person has in place, any questions around safety, plus anything else you feel is relevant. During this process, you should also be completing a condom demonstration using a demonstrator. This can be in person or by showing a video. We do have a condom demo video available through the education section of the eC-Card app, and discussing safe sex such as STIs, consent and healthy relationships.
If you deem the young person to be Fraser competent and that it is within the best interest of the young person to access the app, then you can enter your assessor code to override the app. This allows the young person to have the eC-Card.
When you sign up a vulnerable person aged 13 to 15, you will have the option to select a fixed number of transactions, the amount of times that they can collect condoms, or make it unlimited. Allocating the number of transactions for under 16-year-olds enables the young person opportunity for further interactions with a professional to gain any support that might be required and to enable more platforms to keep young people safe, and additional opportunities to identify any potential safeguarding concerns or referrals onto other services that may be of benefit for the individual.
The number of transactions that the professional would allocate to the individual would be tailored to the young person following their initial eC-Card assessment and would be dependent on their age and their personal circumstances. For example, what the length of their relationship is, their support network, and their accessibility to visit another assessor. If, for example, the young person was at the lower end of the age scale, so 13 or 14, or if they had very recently become sexually active, it could benefit the young person to have another interaction with a professional at an earlier date, perhaps even after just one collection. If following this, the young person then returns to you and you still feel confident they're in a mutually consenting and healthy relationship, you may decide to increase their transactions to perhaps 4. We would recommend that no young person under 16 is allocated more than 4 transactions without revisiting an assessor.
After each order, the user will be notified how many transactions are remaining. When the user reaches the limit of their fixed transactions, they will be presented with a lock screen detailing their next steps and the correct service to contact. Their account will not be removed from the platform. If the limited access user is then set to unlimited transactions, for example a 15-year-old who would be turning 16 within a month's time, at the time they enter the set age range, the platform will transition them automatically to a normal service user with no interruption to their experience. The same limited number of transactions can be selected for a user above 24 years old and will work in the same way, however, the unlimited option is disabled.
In a relationship and sex education poll of young people aged 16 to 17 years old who live in England, 46% stated that they learnt nothing at all or not enough about how to access local sexual health services.
If a young person asks you for information about how to access local sexual health services, they can be directed to call our main Essex Sexual Health Service number on 0300 003 1212, which is open 8 a.m. to 8 p.m. Monday to Friday and Saturday mornings. Or they can log on to the online portal on our website, also known as the Personal Health Record. This gives them access to book appointments and order at-home STI test kits. Those over 24 can also order free condoms via the PHR. For more information about key sexual health topics, we have our website askingforafriend.org.uk, which we have created in collaboration with young people, covering topics like healthy relationships, sexual health, and body confidence.
Thank you for watching. For more information, please check our website. Further training can be found on our Eventbrite page, and if you would like regular service updates, please subscribe to our newsletter.